Hi, everyone. Welcome back to the Finding Genius video series. I'm here with Allon Bloch of K Health, which recently closed a $42 million Series D. And Allon, I'm glad you're here with us. Thank you.
Thanks for having me, Kunal. Good to see
Allon,
you again.
could you briefly describe K Health? And I know you spoke about it publicly, but you've hired as many mathematicians as physicians on your staff. So I think that gives some sense of the value that you're trying to create in the healthcare system. But it'd be great to just have a better overview of the company.
Yeah, look, Kay started out of a bet that we can train a machine to understand the language of medicine, that we can change healthcare and medicine by building better ways for people to access health information, but make it relevant, make it reliable, and make it very, very specific to them. Um, and so that's how we started. We licensed a very large data set of a vertically integrated HMO, payer provider called Maccabi. They're out in Israel and they have their own doctors, their own captive lab, captive drugstore, hospitals on a single EMR. And people don't switch much. So they're able to license 20 years of data for a population of a little bit over 2 million people and be able to look at this anonymous data. That opened up a door for us to be able to do many different things. We chose to focus on that first diagnostic visit, on that primary care visit. And we've since then expanded that into chronic care, and we'll go into all the conditions in the world. But we also we have this app that's based on this data and based on the medical ontology and classifiers that we built there. And that app is free in the US, and we have about 4 million users who use us in the US. But we also have a services layer that sits on top of the app. So we have Kay that you can talk to about your health and you're concerned about COVID, or you have a headache, or you've got a rash, and you want to have an understanding of what it might be. So we can have that data-driven, AI-driven conversation. But you also want to resolve the problem. You want to resolve your headache, or you want to make sure what you need to do in case you do have COVID, or you need a drug refill, or you need you need resolution for your problem, whether it's acute or chronic, big or small. You might need a referral to an expert. So we also enable you to press a button and be in front of a doctor at a cost of below your copay. And we made the price really low to make it really easy for people to be able to access a doctor, not agonizing about the cost of that. And this service layer KMD is run by doctors that we credentialed and work for us as a separate KMD entity, and they use their own medical protocol that is fit for remote care. So they handle a lot of different things, and many people have used it. We started that just to give you a sense, we started K just over 4 years ago. We launched our app in the US about 2 years ago, or 2.5 years ago, and we launched KMD slowly, initially just in 2 states, and now in all 48 continental states. We started about 1.5 years of users.
Right. And so you're replacing the WebMD or the patient going on Google and typing in a question, but now they actually have a primary care physician at their fingertips.
Yeah, we certainly hopefully replaced for many people the need to scare themselves around wrong information. If you want to scare yourself around wrong information, start in Dr. Google. That's a great way to get yourself completely scared based on what doctors tell me is,
Right.
for the most part, irrelevant information. You have a chronic disease, even though your pain just started an hour ago, or your symptom just started an hour ago. That's unlikely to be chronic. But there isn't online, there isn't a system where you can have a very detailed and relevant conversation around, acute systems and chronic systems. But I think, as you said, we moved beyond that. The goal is initially to provide you information, but then also be able to help you resolve it. You might want to go to any other doctor. I'm not stopping you. and I'm very happy. And a lot of our users just use the free components of K, and then they'll go to a doctor or do whatever they want to do. Maybe they're taking over-the-counter medication. Maybe they go and see their PCP, their primary care physician. But for many people, they can press a button and be in front of a doctor in 5 minutes and resolve the problem. Why not? If you've got an issue that's concerning you right now, why try and see the doctor the next day or the following or a week later if you can resolve the problem right now?
Right. And how many of these questions that your 4 million users are asking are fairly common and similar to what the next user is asking versus on the fringe of something that maybe K-Health hasn't seen before? Like, how did it react to COVID diagnoses and things like that?
So Kay didn't know what COVID was.
Right.
So the question is, how fast can it learn from these things? So it depends on data. So we could learn COVID quite fast because we had a lot of people on this and there was a lot of attention, on this. In the same way that medicine, I would argue, learned COVID quite quickly compared to another rare disease. Look, you always need to think about what your role is within medicine and within healthcare, right? Or as an information layer, right? If you're suffering from an abdominal pain or ache or symptom, the vast majority of physicians, all physicians, wouldn't consider the 1 in a million or 1 in a billion thing. That usually comes after weeks or even months of trying to figure out what you have, trying to test you, labs, x-rays, ultrasounds, etc., trying to resolve it by changing lifestyle or stress or whatever else it is. Not everything is resolved like a sinusitis or a urinary tract infection in a fairly simple one visit. Now, to be fair, nothing in medicine is simple, right? But we're not at the point right now that we're resolving incredibly rare genetic mutations that impact 1 in 10 million people. But to be clear, neither is your primary care doing that. That usually happens later, and you need to remember there is a health journey that people go through. And as much as you want everything to be solved in 1 minute, you can't do all of it in 1 minute. Certainly, you need to send people to do labs. You need to send people to do tests, which we do, and then you get the results back. But if there's some specific neurological issue or gastro issue, often people need to go to an expert that needs to look at it, that further. So
Right.
we're learning these things, but our bread and butter has been kind of primary care and chronic care, and even within that, we're still learning and expanding.
Right. So does K-Health, or when you're thinking about this, of where it goes from here, how do you think about it? Is it just continuing to not eliminate, but primary care physicians, consumers won't really go to the primary care as much anymore, or they'll replace that entire behavior?
Look, we employ many primary care physicians and ER physicians and pediatricians on our platform. So, we have a lot of that already. I don't look at it so much as replacing. I'm replacing their wasted time.
Right.
I'm replacing the need to ask basic questions that an intelligent machine can collect and assemble and put in front of you. I'm replacing the need to deal with billing and bureaucracy. Our doctors don't deal with billing. They don't deal with money. They don't deal with insurance. Doctors spend a big chunk of their time doing that. And I want doctors to focus on diagnosis and treatment. I want them to focus on the intelligent stuff. And that's where it'll move more and more. So I want doctors to focus on harder and harder things. And I want intelligent, data-driven systems to be able to serve up information to a doctor so they can focus on the more nuanced stuff and more difficult stuff. So in that respect, it's not... that's a big problem. The other thing, let's just be clear. There are not too many doctors. There are too few doctors. If I take a global view, I would argue half the planet doesn't have access to doctors. Not really. And
Right.
even in the US, it's a very uneven healthcare system, and not everybody has access to doctors that's friction-free. That money and time and the ability to be in front of a doctor is just no-brainer.
Yeah.
So I just want to talk about that, because I don't look at my goals is to create more or less productivity for doctors. That's a secondary point. My goal is to give people access to really high quality medicine. That's my goal.
Right.
In part, I need to do that just to make sure a doctor can spend time on what is important. And I don't want to waste money where it shouldn't be wasted by having a highly qualified professional dealing with stuff that's just, stuff that a machine can do, frankly.
Right. And can you share what the impetus for all of this was? Because you were formerly the CEO of Wix and Vroom. So what
Mm-hmm.
got you attracted to this problem?
I was always fascinated by the way healthcare works and the way medicine works. I mean, you should be. It's just, these professionals that have studied for many years. This is not a let me do a couple of courses and become my family doctor, right? And you're making really, really big decisions with a broad remit about how to operate and work. Um, I started this in part because my dad had a stroke. He had arrhythmia of his heart. He was 69. He was healthy. He was active and doing fine and took care of himself. But he took Coumadin, which is a drug that's highly sensitive to what you eat. And you need to look at a marker called your ENR, which is a marker that looks at the clotting. And he used to go once a month to have this ENR checked, as opposed to having this device at home. And so I didn't know. I knew he had arrhythmia, but I didn't know anything about it. Didn't consider it an issue. I certainly didn't know it could lead to a stroke. And then when I dived into this and realized that, wow, you can actually put a device at home and you can monitor your ANR. I certainly would have encouraged him to do that, and he probably would have wanted to do it himself. So from my perspective, he had a stroke for no reason. And he wasn't allowed to make those decisions. Other people made those decisions. So for me, fundamentally, if I can decide how to manage my money and what stocks to trade and what kind of vacation to take and exactly, the thread count on my sheets in my hotel and level of hotel and how much I'm willing to pay for all these different things. And, why can't I make those decisions about health? Yes, medicine's complicated, but so is managing your money is complicated.
Right.
And I'm going to argue this is more important. So that started, and I started this also in conversations with Adam Singalda and Ran Shaul and Israel Roth, my co-founders, around mistakes that doctors made with hindsight, mistakes they made around diagnosis or treatment and the lack of control we had. So the whole goal was to provide people with control for your health. And it's a never ending problem. You always want to get better. You want to incorporate genetics and wearables and other stuff. But we wanted to start with the core, with evidence-based medicine.
Right.
And that's what I think, wasn't good enough. So we started with information, with the desire to give people much more control over information, which meant also data science and algorithms and a true ability to learn from data. And so that was our approach. But then, of course, if you can create the best AI or data science system on the planet that is really, really good in something and consumers don't understand it. So it can't be in complex, big words in Latin that doctors use because consumers won't understand it, right? It has to be highly actionable. You need to understand. I can't just give you a bunch of information in statistics. You're not a probability, you're a scenario, right? People don't have a 1% chance of having a dangerous condition. They either are likely to have it or unlikely to have it. And so therein lies, the complexity. You want to be able to help people understand this much, much better than other alternatives out there. You want to give people control over this, and you want to also enable them to be in front of a medical professional in a way that they don't think of the cost in terms of time or money or anything else, right?
There's other data driven providers that have companies that have tried to do this in the past. Patients Like Me, I think Galileo is another one trying to do it now. How do you think about the space overall and where maybe others have fallen short or are approaching it from a different angle? just macroeconomically on the entire kind of that space of data driven and evidence
Look,
based?
I don't want to comment on any specific company.
Yeah,
I think there are a lot of claims and a lot of well-meaning people, and there is certainly a lot of interesting projects that people are working on. The reality is, if you remember, Watson came out with this
right,
AI doc and all that kind of stuff, and to put it mildly, it was incongruent with what they built. Um, and they no longer speak about that. I think fundamentally, the complexity of taking doctors, data scientists, mathematicians, software engineers, product people, and designers, and putting them all in the room and making sure you're building something that is, by the way, also HIPAA compliant and fits, state and federal regulations is not easy. This
right,
is not an e-commerce catalog we're putting online. You'll never see conversations in K about money. You see conversations in K about usage and whether it's a clinical setting or not and how it should be used. That's an incredibly tough thing to do. This is not a neat piece of software that's clean, that there's no service, there's no people. Here's a catalog, press a button. At the most basic level, if we're also making sure if we're delivering a drug to your house, it needs to be on the correct dosage 100% of the time. You can't make mistakes. This is not, oh, oops, I sent you the wrong package to your house, right? So everything needs to be incredibly high fidelity, high quality, and very high comfort in terms of our medical audit. And then if people use our service layer, we also need to be very comfortable with our doctors. So that's why we have a separate service entity that we finance, but it's run independently. And that service entity credentials its own doctors. These are all board certified physicians, and has its own remote care protocol based on the fact that they're using remote stuff and based on the fact that they're using K, and we built our EMR. So I think doing that is really, really tough. Of course, hopefully several people do it because there are various problems to tackle.
right,
But anybody who thinks that you can take 500 medical conversations, what doctors call vignettes or medical vignettes, that include diabetes and headache and stomachache and rashes and broken limbs and dental pain and whatever. And based on that, you can build a rule-based system. And then just for good measure, just call it data science or AI. I beg to differ. I think it's really tough to do. Medicine is incredibly complicated. And I don't think anybody would want to go to a doctor and a doctor said, hey, good news, bad news. Good news, I'm really good and there's super easy stuff. So if it's indeed your headache is indeed sinusitis, I'm going to get it right. But, if it's a more complicated stuff that involves further thinking, I just don't know it. That's not a doctor you want to go to see, right? You're calm after seeing a doctor because the doctor also considers more complex, more rare stuff, right? So therein lies, the complexity of medicine. This is not a easy profession. It's highly nuanced. That's why people like to go to highly experienced physicians. And therein, this is not trivial to say the least. And there's always judgment in medicine. The judgment might not mean huge life-changing things in many cases, but sometimes they do.
yeah. What are you just touched on it, but what are the biggest challenges you face launching this business? Is it regulation in the US? Has it been collaborative to work with payers and regulators on a company like this, or has it just been a challenge?
So we have a partnership with Anthem Blue Cross, who are big partners for us, and we have an SDK into their offering, and they've been promoting it, and will continue to do so, down the road. And I think they get it. A lot of people, about 50% of our users on K are. Sorry, actually a little bit more than that. About 60% of users on K are insured. Not all of them through Anthem. And so there must be in the cost saving department of various payers, there must be people that high five every time somebody uses K because I don't send them the bill, and they saved $100. But I think it really depends. Some of them are pure payers, or for the most part, pure insurer payers. People like Anthem. Some of them are payers that also have big provider businesses like United. So our work with Anthem, has been good. They've been, real partners, around what we're doing. But it's a big complex system, and there's more and more stuff we want to do, over time.
Okay. Thanks a lot. I know we're out of time, but I appreciate you joining me for this.
No, I appreciate it. Thanks for having me, Kunal.
Talk soon.
Awesome.